Assalamu alaikum. So today we'll discuss about the asthma. So the layout of our topic will be the asthma and definition of the asthma, pathogenesis of asthma, clinical and laboratory findings, and approach to the management of the asthma. So first of all, the definition of the asthma is that asthma is a chronic disorder of airways characterized by variable airway obstruction, airway hyperresponsiveness, and airway inflammation. And let's now discuss about the pathophysiology. In this asthma, there is the airway inflammatory cell infiltration with eosinophils, neutrophils, and lymphocytes, especially T cells. Goblet cell hyperplasia also occurs, and the small airway plugging with mucus also occurs, and there is deposition of the collagen beneath the basement membrane. Bronchial smooth muscle hypertrophy occurs in it, and airway edema occurs. Mast cell activation occurs, and denudation of airway epithelium occurs. So there are two phenotypic variants of the asthma: allergic asthma and non-allergic asthma. And most common is the allergic asthma, which usually begins in the childhood and is associated with other allergic diseases like eczema, allergic rhinitis, or food allergy. And allergic asthma has also two variants, like in this number one, they are the high T2 endotype and low T2 endotype. In high T2 endotype, there are the increased number of the interleukins, like interleukin 4, 5, and 13. Cytokines are increased. There are increased cytokines, while in low there is less number of the interleukins, like less number of the cytokines, like interleukin 4, 5, and 13. In non-allergic asthma, there is marked neutrophilic inflammation and variable response to standard therapies. There are different variants of the asthma, like occupational asthma, which occurs by various agents in the workplace and may occur weeks to years after initial exposure and sensitization. Catamenial asthma, which occurs during menstrual cycle. Exercise-induced bronchoconstriction occurs, which begins during exercise or within 3 minutes after its ends, and peak in 10 to 15 minutes and resolves after 30 minutes. Cough variant asthma. Cough instead of wheezing is a predominant symptom of bronchial hyperreactivity. So these are the variants of the asthma. Now come to the clinical findings of the asthma. Clinical findings of the asthma is it is characterized by episodic wheezing, shortness of breath, chest tightness, and cough. Following features decrease the likelihood that the respiratory symptoms are due to asthma: isolated cough with no other symptoms, chronic sputum production, chest pain, or shortness of breath with paresthesia. These are the following, and the following features are which increase the probability of asthma, like mucosal swelling, increased secretions, and polyps are often seen in patients with allergic asthma. Eczema, atopic dermatitis, or other allergic skin disorders may also be present. Wheezing or prolonged expiratory phase during normal breathing correlates well with the presence of airflow obstruction. During severe asthma exacerbation, airflow may be too limited to produce the wheezing, and only diagnostic clue on auscultation will be globally reduced breath sounds with prolonged expiration.